Hi everyone, thanks so much for joining us today. My name is Cheryl. I am one of the medical estheticians and laser specialists here at our North Raleigh Synergy location. Today I'm going to be going over everything about Moxi BBL laser, my favorite combination laser that delivers very promising results, so stay tuned. The most common complaint that I get as a provider, clients come in and they talk about sunspots on their face, melasma, hyperpigmentation, capillaries. So when that is one of the main concerns of a client, I immediately am like, okay, we're going to talk about Moxi laser and broadband light treatments. And so I'm going to go over the differences of each one and why we would combine them. So Moxi is one of my go-to lasers for clients who are nervous about a laser treatment, someone who has never done anything to their skin, but they really want a clinical promising outcome. Moxi is a non-ablative laser, and what that means is that we're not removing the top layer of tissue. Instead, we are going to be using a fractionated device, which is Moxi, and it uses a fraction of the skin, or it injures fractions of the skin. So if you think of this being the laser, it's going to go like this, while the rest of the skin is completely healed. That makes for really easy downtime, less swelling, not as much scabbing, no bleeding, anything like that. What Moxi is designed to correct is going to be pigmentation, texture, and pores. Another amazing thing about Moxi is that it can be used on all skin tones and skin types. We can also use it on clients that suffer with melasma, which is your pregnancy hormonal induced pigmentation that is very tricky to correct. Moxi uses low thermal heat, so we are able to treat it without spiking melasma. That's going to be the biggest difference when we're talking about Moxi versus BBL. So all skin tones, very little downtime, and melasma safe. So BBL does not stand for Brazilian butt lift, it stands for broadband light. So it actually uses wavelengths to fragment pigmentation in the skin. It also is one of the lasers we have here that corrects redness, so broken capillaries, rosacea, more deeper and stubborn pigmentation in the skin, so like really true sunspots, ones that are maybe round or scattered. What we're not going to use BBL for is deeper skin tones and melasma. So BBL, we do a corrective BBL and a maintenance BBL. The corrective is going to go after all the browns, the reds, collagen. The maintenance is going to be when you've gotten to your happy point with your skin, you're just coming in to prevent any pigmentation from coming back up or for keeping the rosacea and redness diffused. BBL's downtime is actually the most minimal downtime of all the lasers that we offer here. If you have a lot of brown spots, you might see those come up to the surface of the skin and freckle away, but you're not going to have any rough or grainy skin like you will with Moxi. So your skin texture will feel smooth the whole time. You might have a tiny bit of swelling around here for going after really aggressive capillaries or redness, but overall you're able to put makeup on, do your own skincare afterwards. It's a very easy transition. With BBL, we usually do about 3 treatments, same with Moxi, but the wonderful thing about combining them, it usually will knock off 1 treatment, so you're looking at more like 2 treatments. Ideal candidate for doing both treatments are going to be someone who comes in and is a candidate for BBL and Moxi, but they're really looking for faster outcomes with 1 to 2 treatments. So maybe it's someone with a lot more pigmentation or maybe dull skin. This actually will help correct, plump up lines. So if you feel like you're starting to see the signs of aging, dry lines around the eyes, some texture, the heat that the laser is putting into the skin is enough to produce some collagen and plump the skin. It leads to healthier tissue, so long-term results are going to be more anti-aging. So we're not just correcting pigmentation, we are going to be plumping up those lines, helping with water retention in the skin. A lot of times clients feel like their products work even better after 1 laser treatment, just because the products can penetrate better into the skin. When you combine these 2 treatments together, you are going to notice results as far as less redness in the skin. We're going to actually still continue to treat those capillaries, but really you're going to get a 360 approach to the skin. We're going to be treating from deeper level to more superficial. So with that being said, you might notice a little more downtime. When we're putting so much heat into the skin, you might have a little bit swelling, usually around the cheek area. You're gonna have some rough, grainy skin for about 5 days. So what the laser Moxi does, it actually makes the pigment come up to the superficial layer of the skin, your stratum corneum. It gets rough and grainy and then flakes away. It won't flake away until the skin underneath is healthy enough to sustain being left without that kind of scab or wound on top. But it's so microscopic that you're not gonna be able to really see it. You're really gonna feel it more than see. So you can cover it with makeup after about 24 hours and you're able to live your day-to-day life. I would say no working out for about a day, no retinoids for a day. That's actually a good point I wanna go over too, is prior to coming in, please avoid any retinoid or retinol use for about 5 days. I would avoid spray tans this time of year. Like myself, I'm ghostly, but I really want a laser, so I'm gonna hold off on spray tanning for about a week. And then any heavy exfoliants like your salicylic acid, your glycolic acid, benzoyl peroxide. So now I'm gonna go over a patient's before and after. She came to see me for Moxi BBL twice, 6 weeks apart. So these pictures were taken with our Vizia camera, which is included with all of our laser consultations. So first we take really good up close and personal photos of your skin. That way you can describe to me the concerns that you're seeing, but also it might show something that you didn't know you presented with. So this client's main concern was the sunspots on her face and the dullness in her skin. So I recommended doing the Moxi BBL combination to help plump the lines, get rid of those sunspots, and give a beautiful glow to the skin. All right, so I can't talk about laser without talking about Halo Laser. Halo Laser is a little bit stronger than Moxi and BBL. It's going to address some things that Moxi and BBL will not address. I usually will do Halo on clients who come in talking more about fine lines, dullness in the skin, really kind of enlarged pores, heavy texture, and then also acne scarring. So Halo is 2 lasers in one. It's dual laser. So we're gonna have a non-ablative wavelength similar to your BBL, your Moxi, but we're also going to have an ablative wavelength going into the skin at the same time. What ablation means is that it's vaporizing the top layer of skin completely. It's like a full field of it. So with that being said, you're gonna have a little bit more downtime, but usually results can be a little more intense as far as those lines go. I usually will do Halo on someone 40s and 50s. It can correct a lot of pigmentation, but it's not our go-to pigment correcting laser. So if you have fine lines, wrinkles, dullness, and then also pigmentation, you might be one of my clients that comes in for 1 Moxi BBL, 1 Halo. There's your 2 treatments, once a year, and you're done. With your Moxi and BBL laser, you are gonna see your results in as little as 5 days. As soon as those little dead skin cells that are sitting on top flake away, your new, beautiful, healthy, glowing skin, pigment-free, will be showing. So a lot of clients are very pleased in 5 to 7 days. Halo's a little bit longer since we're really using that laser to produce collagen, plump the skin, help close pores. Sometimes it takes up to 2 to 3 months to see full results, but the good news with that is you're gonna see something very quickly, and then it's only gonna get better over time. So usually that texture and pigmentation will be gone in about a week, and then line reduction will be roughly 2 to 3 months. So if you've not been seen at any of our Synergy locations for laser, you're going to want to come in for a consultation first with any of our laser providers. The reason it is so important is, 1, to get some really good before photos to hold us accountable, and then also to make sure you are prepping your skin correctly for whatever laser that you are picking. For example, if you have melasma, we're going to prep you with a tyrosinase inhibitor, which makes the pigmentation kind of go to sleep. It's almost like a Xanax for your skin. That way your pigment doesn't flare up since we're putting heat into the skin. So something as simple as a 60-day supply of pads, you'll be on them for a few weeks prior, will just ensure that we don't have any darkening of pigmentation, and it makes your results 10 times better. Another reason it's so important to come in for a consultation is because everyone's skin is so different. what you think you see is wrong with your skin might be a little bit different than the camera picks up on, or that I or one of our professional colleagues pick up on. So once again, come in for that consult, come in with questions, do some research first. That always helps us be able to answer your concerns a little bit better. Thank you so much for joining me to learn a little bit more about lasers. If any of these seem like a good option for your skin type, any of our providers would be so happy to see you and welcome you into Synergy. Thanks again. Bye.